What? Let me see. It just says Nicole Edwards. That's the only thing that came up. Oh, hold on, wait. I think we're live. Yeah. Okay, we're live. Nicole, I'm sorry.
Okay.
Hey there, everybody. I'm Tre Tailor with Coping with COVID. I was trying to get Nicole personal, her professional page on. While I'm talking, maybe you can do that. We have been here every week, every day this week, giving you updates and information about this new state of the world that we're living in right now. I'm Tre Tailor, and we're providing you information. Of course, we talk with Dr. Tisha Boston. We talk with Dr. Tasha Boone. Yesterday, we talked with Ashley Wilkerson, who is a elementary school educator, author, and entrepreneur, with information for those of you like me are now in this situation where you're homeschooling your little ones. Next week, we'll also talk to Dr. Cheryl Williams with Agape Christian Counseling Center, because mental health is really become a big issue right now. We'll also speak with Alicia Porter with Accountant and Tax Source about where your stimulus check is, when you're going to get it, and who's going to get it. And Attorney Edie Lane is going to speak with us next week about you having problems paying your bills, particularly your rent and mortgage. A lot of those payments are being furloughed right now. But what happens really, as far as that's concerned, what rights you do have. So we're going to be updating you throughout the next couple of weeks with information that you need and tips that you also would like to have. Today, we're joined by Dr. Nicole Edwards. She is a board-certified family medical physician here in Columbia, South Carolina. Thank you, Nicole, for joining us. We appreciate it.
Thank you, Tre. Thanks for having me. Hello, everybody.
Yes.
I've missed you, Tre.
I know. Yes, but I see you online. I see you online, and I know, and because that's why I called you about doing this interview, because you've been you've been very outspoken about this particular issue, and really been encouraging people to take it seriously. Hey, Shayna, thank you for joining us. Just really, encouraging people, because I think you know someone who has been affected by the virus.
Actually, I know someone who's been affected, and thankfully they have recovered, or recovering. It's a long process, recovering. And now I know someone who has passed away.
Oh, no, Nicole, I'm so sorry.
It made me start crying now again.
Yeah.
So this is what I told a group of my doctor friends yesterday. It hits differently when you know someone. I think a lot of time, and I think a lot of what people are dealing with is they think it can't happen to them, and then B, because they don't know anybody who it's been affected by, so they're like, it's not really, even me as a doctor, but now it's starting to hit a little. It's hitting closer. So
yeah, I'm so sorry to hear about your loss. Yeah, I think more and more and more as the reports come out, and this is the report I want to talk about today, I think it becomes more and more real, but it seems very sci-fi. You know what I mean? When I was talking to my brother who's in New York, which, it's very prevalent there. You see people walking around with masks on and gloves on. It seems like you just stepped out of a Stephen King novel or movie.
It really does.
And I don't think any of us thought we would experience this in our lifetime.
Right. It's almost surreal. And I think it's a couple things. One, it's a coping mechanism to try to downplay it in our minds, to say it's not affecting me and it's not that bad. You would be surprised. Even this morning, all the people who are still saying, oh, they're inflating the numbers and people are making this up and this isn't real. No, people, this is real. It's real and it's happening. And as much as we all are crossing our fingers and hoping that it'll get better quickly, unfortunately, we're probably going to see it continue to get worse before we see it get better.
Really?
Yeah.
Well, there was a report that came out earlier this week, which is what I wanted to talk to you about. CNN reported that the White House was notified on Wednesday by Henry Feinberg. Now, this gentleman is with the National Academy of Science and a former dean of health at Harvard University. So this guy's no joke. He's the real deal. And he has said that there are studies that show Not only can you get the coronavirus through someone coughing or sneezing, but now you could be talking to someone or just in someone's breath. You know, they breathe and you could possibly get it. Is that true?
It is. And let's think about the mechanism of action. You know, as a doctor, this is what we do. We learn about mechanisms of action. So think about it. When you cough or you sneeze, what you're doing is forcefully pushing those particles out, right?
Yeah.
And if those particles have the virus in them, then they're leaving. But what you don't think about is just by talking, you're also, let's just be real, because that's what we like to just keep it real. Have you ever been talking and some spittle just kind of flies out your mouth a little bit? I mean, it's real talk, right?
You're right. It happens.
Right? It flies out. Or have you ever noticed when you sing, some people have those
the mic shields,
shields or the mic guards, and we call them
wind guards. Yeah, in radio we call them wind guards.
Yeah, spit guard is what it really is. And I don't know if anybody's ever had to clean those. They smell horribly.
They do smell.
Why? Because everybody's breath and everybody's spittle flies out and gets in it. So that's the thing when we're speaking, when we're talking, even with certain, you know this because you're in radio, when you say certain letters like P's and T's, that's spittle and it's coming out your mouth. And so if you've got virus, that can also be expelled. What I also was really trying to drive home to some of the groups and churches and things is like why we don't want necessarily people in and singing and preaching is because when we sing, we're actually, what are we doing? We're taking a deep breath.
Yeah, we're taking a deep breath, blowing it out.
We're letting it out. And so you're actually pushing out more. And so, yes, it's very airborne. We know that the coronavirus and COVID-19, it is an aerosolized or it's in our, it can fly in the air, right? And so what we're also noticing is that the virus, it can actually stay. We know that, you know, it can stay 8 to 9 hours on surfaces. We know it can stay a couple of days on like copper surfaces, on plastic. It can stay a couple of hours. But what people are not realizing is that it can also stay in the air for up to 2 to 3 hours.
Right.
Okay? So if I sneeze, well, no, let's just say if I cough or no, let's not even do that. If I'm talking and it's aerosolized in the air, then yes, and it can be there for 2 to 3 days. Let's say I'm talking here and then somebody comes in my office afterwards. If I had it, they can breathe that in. Here's the other thing though, when you cough or you sneeze or it forcefully comes out, you know how they say do the 6 feet distance?
Yeah, between.
Well, actually, when you cough or sneeze, you actually can propel those aerosolized things. You can 8 to 10 feet. Okay, and so is 6 feet really even enough?
Yeah.
Is it?
Yeah. Well, Dr. Fauci, who of course is with the Corona Task Force, also said kind of what you're saying, that it really depends on how much of the virus someone has and if you are in a situation where air is circulating. So like you said, if someone has, I guess, a lot of the virus and they're in an enclosed area in a room or something like that, obviously, as you said, you can talk, you can breathe, the virus is still in the air, you walk by, you can get it. If you're outside where air is circulating, the chance of that happening is lessened.
Lessened, but still not impossible.
Gotcha.
So you still need to be careful because it still can fly around. Now, you have more area that it can go, so it might not just be here in one spot, but it is lessened, but not impossible to get it. Okay.
Right. Well, that brings me to another point that Dr. Fauci said, that it depends on how much the virus you can get or how much of the virus you have. So that means you can have a little bit of the virus or a lot of the virus.
Yeah.
How does that work?
So it's called a viral load. I don't know if anybody is, ooh, I just touched my face. Wash your hands, y'all. Wash your hands. Okay. I just put hand sanitizer on because I just touched my face. But so when we deal with things like HIV, the human immunodeficiency virus, we monitor that based on viral load. So we know that if some people have a high viral load, then they have more of a chance of being sicker, right? Because they have more of the virus versus somebody that has an undetectable viral load. So then that means that you are in a healthier state because you don't have as much virus.
Gotcha.
And so, yes, some people can have more of the virus than others. Think about also about how much you're being exposed to something. For example, if you are actually staying at home where you're supposed to be, not going out, then you are having less of the virus being exposed to you versus somebody who's like working in a doctor's office or in a hospital who has more of that virus coming at them at a lot of times. Now, this is just my theory and some of my other doctor friends as well, but that's why we're seeing healthcare providers are getting hit a little bit harder because we're exposed more. And so we have higher amounts of that viral load. And so it makes you sicker, right? And so you need to be able to really stay inside and stay away so that you can lower that load. And then number two, you want to boost your immune system as much as you can so that your body can fight if you are exposed to the virus. That's the other thing too, Trey, is that, and I think this is where people are not taking it seriously. I might not have symptoms, so that means I'm not spreading virus, right?
Right.
Not true. You can be totally asymptomatic, but still be spreading the virus to someone else. So that's why we're really trying to drill this whole stay at home recommendation or plea, is that because you might be asymptomatic, but then can pass it along to someone who they might be the ones to get the symptoms and get sick.
Right, because you could be asymptomatic and still have it. Your symptoms just not have come out yet. Correct.
Might not have come out yet, and they might not ever. Right. But you might then pass it along to someone else. That's why I kind of made that analogy of Russian roulette. You don't know if it's going to hit you or not. And then somebody else, it might hit just, and it might be what takes them out.
We're talking to Dr. Nicole Edwards, board certified family medical physician here in Columbia, South Carolina. We're talking about a recent report, actually Wednesday, that the White House received about COVID-19, that not only can you get it by coughing or sneezing, but just by simply talking or someone breathing, and you happen to be that person that walks in that area. And so, Nicole, what you're saying really kind of even makes the case even more for face masks.
Yes. So initially, and now here's what you guys also need to understand. We are learning more about this virus day by day, sometimes hour by hour. And then when it initially came out, we were all like, okay, what's the point of the face mask? Really, where face masks, originally what we thought was, we were telling people, okay, you don't need to wear a face mask because it's not going to protect you from what's going to come at you, right?
Gotcha.
Because it's not a tight-fitting, sealed face mask.
Right.
So what I told a friend of mine was like, unless you're sick, unless you're coughing or sneezing, what that mask does is it protects my droplets from getting to you. But now what we're learning is that since this is an aerosolized virus, and since you might be asymptomatic, like we just talked about, maybe it would be best to go ahead and have everybody put a mask on so that just in case I am not symptomatic, and I might have it, I'm not spreading it. Again, the mask that's not a tight seal, it more protects you from me, not me from you.
Right.
Does that make sense? Like, so
absolutely.
The what's coming out of my mouth. It doesn't protect me from what's coming out of your mouth.
Right. Not the receiver, but the giver, so to speak. Yeah. Want to say hi to Candace Brown Harris for joining us. And also, is that Zarina? You know her. Zarina Peace. Also, Maxine Moses has a question. Nicole, we're talking to Dr. Nicole Edwards, board certified family medicine physician here in Columbia, South Carolina. Maxine wants to know, Nicole, can you be tested to see if you had it after recovering?
So after recovering, so when they're testing, they're actually testing for the active virus. It depends on how they're testing. So if they're testing what they call I'm about to get into it. If they're testing the IgG, which means you've been exposed to it in the past, versus the IgM, which means you have it right now. So it depends on how what they're testing for. So it's kind of a tricky question. Since there are different types of tests out there right now, I can't answer that specifically. You would need to ask your wherever you're going to get tested. Are you testing my level currently, or are you testing if I've been exposed in the past? Here's the other thing that we're noticing and that we're learning about the coronavirus. It is rapidly mutating, okay? And so and this is what I originally had said, coronavirus is a group of viruses, right? This specific one is the COVID-19. It's the novel COVID-19. That's the specific virus in this family of coronaviruses. And so we know that this one is a new one, but coronavirus has been around for a long time.
Has been around, okay.
Right. And that's why everybody was like, oh, but it's on the Lysol bottle that it fights coronavirus. Yeah, it fights the family. But this specific strain, because this is a new strain, we're actually going to have to build up immunity to this new strain. And that's why it's like people are getting hit, because we have no immunity to it because we haven't seen it before.
And that's what I was going to ask. So is that what makes this such a big deal or so dangerous? Because it is new, and one, there's no test, there's no cure, there's no, and like you said, no immunity built up. It's just new. Right.
It's new. Well, there is a test, and the thing is, it's not.
Well, now it is.
Come out with the rapid test, but before, we didn't know. But yes, it is a new strain. So, like I said, these viruses, they mutate. And so it's a new strain of this virus. And because there was no immunity, when people are getting it, it's the first time. So your body doesn't know how to fight it. Your body's immune system fights things that have been exposed to it in the past. So if it's never been exposed before, your body doesn't know how to react to it. Gotcha. And that's what makes this difficult for certain people to treat. What they're also doing now is that they're taking, they've been trying to get maybe the blood of some people who have had it and recovered from it and gotten better, and saying, okay, let's test their blood and see what things in the immune system that we can kind of look into to trigger for a possible vaccination or a cure. But yeah, right now there's just so many questions.
Yeah, which kind of goes back to why the flu virus has some flu in it. People always ask, well, should I get the flu vaccine because it has flu in it? Because your point right here is you need some of it for your body to build an immunity to it.
Right. Now, the difference is that there are different types of flu vaccinations. And so there are live vaccinations, and then there are attenuated or killed vaccinations. So sometimes it's not a live strain of the flu. So no, most of the flu vaccines don't give you the flu. Okay.
Right.
Because it's not a live virus. But yeah. So
yeah. We want to say hi to Lisa Edmonds and also Petra Edwards. Thank you guys so much for joining us. We're here with Dr. Nicole Edwards, board certified family medicine physician in Columbia, South Carolina. We're talking about the CNN report that the White House was notified on Wednesday that not only can you get the coronavirus from coughing or sneezing, which is what we had heard previously, but now from just breathing or talking. Dr. Fauci, who is with the Corona Task Force, is saying now that there are active conversations going on about everyone wearing a face mask. And Nicole was just talking about that, how that it now it's really is protecting everyone.
Right. So I don't know, Trey, did you hear about the choir up in Skagit County up in Washington? They had choir practice.
Yes.
And it was 60 people came to the practice.
Yes.
They were even, giving hand sanitizer out at the door. But and they were trying to say, okay, let's not touch, let's not hug, and, do all the things that we do at choir rehearsal. But 45 of those 60 people got the virus, right? Got it. And out of those people, 5 of them got hospitalized and 2 or 3 of them have died. So we do know. And like I said, singing, you're actually pushing it's aerosolized, y'all. It's in the air. It's in the air.
Well, here's the thing about face masks, Nicole, because I spoke with a physician, Tisha Boston, earlier in the week, and she mentioned that several times she's seen people that have masks that really are ineffective because they don't cover the area. It's not like a tight fit.
Right. So there are 2 different types of masks. There are what we call a surgical mask. I wish I had one here in the office, but there's a surgical mask, which basically just covers your nose and mouth. It does not have a tight seal on the length, the edges. So without the tight seal, stuff can still get in. All that does is it blocks against like things that spray, so it doesn't get into that area. And then if I cough or sneeze from talking, it blocks from from my spittle coming out, versus the N95 mask, which is a fitted mask. You have to be actually fitted for an N95 mask.
Right.
It's sealed to your face, and that is to protect stuff from coming in. Those need to be worn by the healthcare professionals and by healthcare staff who are actively fighting this virus and are there in what we're calling the front lines.
On the front lines,
they need those masks. So guys, I don't know where y'all are getting these N95 masks from, but stop it. Right.
Yeah.
Same goes for the hospitals and for the
that's what she was
workers.
saying. Yeah.
Because you can just get a surgical mask, and they're even making them now where you could just get some material and hold it together just to cover yourself, to keep your spittle from getting to everybody. But save those N95 masks for our healthcare professionals who are actually actively fighting the virus right there in the room, and they need to be protected.
And that's what I was going to ask you. So since we shouldn't get those kind of masks, and there are masks, everybody's is making a mask, and you know, big ups to folks making a mask. I said this earlier in the week. I know someone out in LA that's making some masks. He's a designer. He's going to join us in a couple of days. So should we be conscientious about the type of mask we do purchase? What are the guidelines for purchasing or having a mask?
Like I said, it's okay to get just a regular surgical mask or any type of covering. Like I said, you can grab.
What about a bandana?
I was going to say a bandana, or I was going to say one of those, the bandana. Our hair with. That would be good. There are certain materials that are, a couple things. One, it needs to be breathable.
Gotcha.
Okay, because you got to be able to breathe through it, right? So it has to be breathable. And then it needs to be something that has some filtering process, so that it's not getting everything out.
Gotcha.
But so you can, you know, whatever's out there, like I said, that's breathable and that has some filtration, you can get those type of masks, and then you're not taking away the sealed N95 masks that our healthcare professionals and our hospitals are needing for them to stay safe. Now, first of all, if you are high risk and you have hypertension or diabetes or an autoimmune,
you need to stay at the house.
You need to stay your butts inside anyway and be outside. That's first of all. But if for some reason you do need to go out and you have high risk, so like if you're going to the doctor's office, which is the only reason, and really I would hope that your doctor would have telemedicine, so that you wouldn't have to come out at all. But really save those. Anyway, I saw this old couple. No, I was going to say, I saw this old couple walking. They were walking into a store that wasn't even an essential store. I can't judge them. I mean, they had a liquor store. It wasn't the liquor store. It wasn't. It was the Big Lots. Okay, but I saw them walking in. But they both had on N95 masks, and I was like, well, first of all, where y'all get the masks from? And I know the hospital down the street is having trouble. Okay, where'd y'all get them from? And number two, why are y'all out here? And if you needed to wear the mask, then y'all shouldn't have been out here anyway. Right. Send your daughter or your grandson or something to come and get. And okay. But yes, save the N95 masks for our healthcare professionals who need them, since they are the ones that are actively fighting the virus. But at this point, you can just get a bandana. And there's even ways that you can just take the bandana, you fold it into threes, and then you get a hair scrunchie on one side and you wrap that bandana, and the hair scrunchie on the other side, wrap the bandana, and then you can tie it over your ears like that.
Well, that's what Maxine is saying there. There are DIY videos online to show you how to make a face mask, you know.
A bra, Max? Oh, okay. I've seen one too where they took their husband's shorts.
I guess it depends on how large, what size bra you wear.
Well, that too. It needs to cover somehow.
Right.
But yeah, like I said, I saw even one where they took their husband's shorts, you know, their shorts, and put it over their face, and it covered their. I was like, okay, I just hope they're clean. But But there are ways to, you know, that you can make your own mask, and at this point, you are making the mask, like I said, to protect others. So right. I applaud you if you're doing that. Thank you for thinking of someone other than yourself. That's a big deal. And I think that's the problem right now, is that a lot of people have been unknowingly and maybe even knowingly selfish, and we're not thinking of others. And I know that people are getting stir crazy. We're locked inside and we're like, what am I supposed to do? But by doing that, you are protecting others, right?
And yourself. You're protecting yourself too,
and yourself. But I've seen people who say like, oh, I don't have any immune disorders. I don't have any problems. I don't have hypertension. So I'm low risk. I'll be fine. Okay, well, that's great for you, but think about all the other people out there who aren't.
That's right. That's right.
And just for once, I know it can be hard, but if we all just kind of crack down and stay inside and follow these guidelines, we can actually get through this faster. It's going to be a longer process the longer we make this take. If we look at places like China and places like Italy, the reason why their numbers are now coming down is because the whole country shut down. Okay. Right. But we also have to look at surface area and size. If you look at the size of Italy and you look at the size of New York, okay, there's kind of the same.
Yeah.
But so just think of us, we are like 49 additional Italys, right? Because there's 50 states. Yeah. And so our numbers are, they're going up.
Yeah. What about gloves, Nicole? Are you a proponent of wearing gloves also?
So here's the thing, because the virus can stay alive on surfaces, on plastic surfaces up to 8 to 9 hours, on copper surfaces up to 2 to 3 days, you can wear gloves if you are out in the public to help prevent from whatever you're touching. The problem is, though, if you wear the glove and then you touch your face, then it almost defeats the purpose. But I do think that you can wear gloves to help protect in case there's anything out. Don't fall into the trap, though, that if I wear gloves then I can be lax on my hand washing. Wrong. If you wear the gloves, you need to wear them, you still need to take them off, and you still need to do the good hand washing in all the crevices for 20 seconds with hot water, and you still need to do it often, okay? And then if you're gonna be wearing the gloves, like I've seen people at the bank or at the fast food, and they're wearing gloves, but I hope they would be changing those gloves in between their transactions and things. Yeah. But yes, the gloves can protect against touching surfaces.
We're here with Dr. Nicole Edwards, and she's been telling us about the recent report that the White House received that not only can you get COVID-19 from coughing or sneezing, but you can also get it from just breathing or, I guess, laughing, anything, breathing, breathing on someone. We've also been talking about the need to wear masks. She's a big mask proponent and glove proponent. I also read, Nicole, that COVID-19 is not as infectious as TB or measles.
In terms of?
Infections and being infectious.
Oh, okay. Well, I mean, here's the thing. The tuberculosis, measles, they all can spread.
Exactly.
And at this point, we just need to,
Yeah. We just need to be conscientious.
Yes, we got to be conscientious. It might not be as infectious, but I don't want to downplay. I think that's the problem right now. There's a lot of downplaying of COVID-19. And again, people are thinking either A, because they're not affected, or because it hasn't affected anybody close to them, that then we're downplaying. So I hesitate to say it's not as infectious, because I don't want people to suddenly not take it as seriously. I want y'all to take this serious. People are dying from this, right? Yeah. People are, and it's not just the old people.
And that's what I was going to say. It's not just
underlying
old people underlying conditions.
Underlying. Let's say it correctly. Underlying, not underlining. Underlying. It's not just them, y'all. Right. It's also people that are young. It's also in children and in babies and in people without any underlying conditions. But if you do have some, and see, that's the other thing. What are people considering as an underlying condition?
Yes, that's right.
Because somebody's like, oh, I just have, I'm fine. I'm like, really? You're fine, but your blood pressure is 144/90. You might not consider that an underlying condition, but it is. You probably have chronic hypertension, and that is actually one of the highest comorbidities that COVID-19 can affect, is people with chronic hypertension. Yes.
Well, let's talk about what those, since you mentioned that, people not recognizing what the underlying conditions are. What are some underlying conditions? Because people are probably thinking just respiratory conditions.
So, of course, anything respiratory like asthma, COPD, emphysema. Okay, those are some of the big ones. But other ones, if you are immunocompromised in any way, if you've recently had surgery within the past 3 to 12 months, right? Your body is still recovering from that surgery. That makes you your immune system is not as strong as before you had the surgery. If you have an autoimmune disorder like lupus, like rheumatoid arthritis, like multiple sclerosis, if you have things like diabetes, which we're in the South. So how many people have diabetes in the South? All y'all here in South Carolina, just take your butts inside.
Yeah, sugar.
If you got the sugar, right? If you got the sugar, if you have hypertension or elevated blood pressure, and that's the other thing is a lot of people have hypertension and they don't even know that they have it, right? And so that makes you at increased risk. Certainly, if you have any type of heart disease, whether you've had a heart attack, whether you have coronary artery disease, whether you have anything cardiovascular disease in general makes you at a high risk, right? Even people, this is one that I've actually just been reading more about myself, people that have had any type of gastric bypass surgery, actually that makes you at any time, right? That makes you at a high risk. And we know that down here, well, everywhere in America, but especially down here in the South, there's a lot of people that have had gastric bypass surgery that actually put you at a higher risk. Why? Because there's a form of malnutrition, because since we've kind of redone your gut, you're not getting all the nutrients and things that you need to be getting all the time, and that lowers your immune system. So if you've had, like I said, any type of surgery, any type of gastric bypass surgery, any type of heart disease, any type of autoimmune disease, diabetes, you are at high risk. Cancer. Oh yeah, we didn't even get to the big ones. Cancer. Yeah. If you've had blood transfusion, not blood transfusion, but if you've had a chemotherapy, these are all things that make you high risk.
If you have HIV/AIDS.
HIV/AIDS, yeah. Anything that affects your immune system, right?
Gotcha.
Even just recent illness, right? So if I had sick with something else 2 weeks ago, my immune system is still having to build up from that recent illness. And so if I get hit with something else, it can knock me back even further. Okay. Yeah. So I really want, at this point, it would be best if we treat everybody like everybody has it.
Gotcha.
Okay. Because that's how serious this is, and how serious, I don't think people are taking it seriously. It's not a conspiracy theory. It's not something that they're making up. This is real, y'all, and people are really dying from it. We have got to flatten the curve. We've got to stay inside. We've got to stop this.
People are dying. People are getting sick in huge numbers. Our medical profession, they are tired because they're overworked. They're working. They're putting their lives at risk, their families' lives at risk. There are not enough morgues and body bags and hospitals. It's a pandemic.
Yeah. Well, and think about this, Trey. There are everything that people used to go to the hospital for before there was a COVID. So car accidents, heart attacks, strokes, having a baby, surgery, all of those things are still happening along with COVID, right? And so where are we putting, every time I hear an ambulance, my heart just goes out, and I have to say a prayer, because I'm like, where are they going to put all these people? We were already kind of maxed out. If you've seen, even just here in town, they've had to build new wings on the hospital. We already were maxed out on our healthcare system, and so now to add COVID on top of that, where are we going to take care of all these people, right? Where? I don't see it. That's the scary part of this.
Yeah, I can tell that you are very passionate about it, and that I really can, and I can tell, because you're looking at it from a different standpoint. You're in the trenches. You're a medical professional. You're in the trenches. You see it happening, and you also see people kind of not taking it seriously. Yeah. And it's serious.
Yeah. So we, my husband and my family, we, wanted to get the kids out the house, and wanted to let's go for a walk. So we said, let's, we walked around the block every day, and let's go do something different. Let's go walk along the beach. We got to the beach. It was jammed, not to the beach, but over to the lake. To walk across the dam. When I tell you, it was jam packed. There was no parking spaces. And there were so many people. And I was like, turn around, let's go. We are not walking here, because even though we're out and about and we're in the air, everybody's still too close, right? And think about it. Everybody and their mamas is at Lowe's, which I get it. Okay, now is some time I can go and do my garden and do it. There's too many people like just standing in line. No, and we're spreading virus because you might be healthy, but you could still be spreading stuff. And then you also have to look at the fact that if you have been exposed, you might not even get symptoms until day 7 or day 10, right, of your 2-week. That's why they're asking if you have a known exposure, wait 2 weeks because it might be day 10 or 11 before you even start to show symptoms, right? And so people they're not understanding that this is not vacation, y'all. Right. I wish it was, but it's not a vacation. We can't just be out doing everything willy-nilly. That's just not the way any of this works.
Dr. Nicole Edwards, board certified family medicine physician in Columbia, South Carolina. Thank you so much for your time and your energy and your efforts and for sharing your expertise. If people want to get in touch with you, how can they, Nicole?
I'm available on all social media platforms at Dr. Nicole D.O. That's DrNicoleDO. Also my website, drnicoledo.com. And then I do a lot of things on social media. I like to Dr. Nicole D.O.
Yeah. And if, are you accepting patients?
I am. And I do, even before COVID, I did practice telemedicine.
Yes, you did.
And so, yes. And my practice is all cash based. So you don't have to have insurance. That's my other concern right now, Tre, that we might have to bring me on another time to talk about with people losing their jobs right now. And people are probably going to be losing their insurance at some point. What are they supposed to do? Right. So you have to find a practice like mine that, you know, I have very affordable prices at a cash-based price. So you don't have to worry about that. But yes, I do see telemedicine patients and I am taking new patients. And so, yes, you can come and see me. You can, if you want to access my telemedicine portal, it's drnicolevisit.com. So drnicolevisit.com. And then you can access my telemedicine platform if you have something, you know, that you need to be seen on telemedicine for. And on there, it does have a list of what things you could be seen. And even if you need some COVID screening, I do offer that on there as well.
Right, Nicole, Michelle just gave your website. Thank you, Michelle. Is that
Thanks
Michelle?
so much. Yeah, that's Dr. Michelle. She's excellent. I love Dr. Michelle. Thank you so much.
Yeah, she just said that there in New Orleans, the people were out at the shore. And I was going to say, I went out to the dam about 2 weeks ago, and it was packed, like you said. And just this couple of days ago, Michelle and everyone else, our governor here in South Carolina closed the beaches, which
finally. Yeah. Well, and you know, because the thing was this weekend, it was beautiful. And so like I said, people think they're on vacation. Oh, well, let's just go to the beach.
Well, no. I think people also they're stir crazy. They're in the house and, you know, and like you, I've just been walking around the block. I did go to the State House a couple of days ago and it was packed there, but it was different than the dam because you could really spread out a little bit more at the State House than on the dam. You know, you're walking back and forth across people, but just be careful, be safe, stay strong, be blessed. And thank you again so much, Nicole, for joining us. Thank you for joining us on Coping with COVID. I'm Tre Tailor. Don't forget, next week, we're going to talk with Dr. Cheryl Williams with Agape Christian Counseling. She is a mental health professional. This is affecting people, I know, Nicole, you know, in so many ways. So we're going to talk with her. We're also going to talk with attorney Edie Lane that's going to help you navigate some of those bills. Many of these companies, which is great, have been waiving fees for your mortgage and for your rent. Well, what rights do you have? We're going to talk with Dr. Edie Lane about that. And then Alicia Porter with Accountant and Tax Source is going to talk with us next week. She's going to talk about that stimulus check, when you're going to get it, how you're going to get it, what do you need to do to make sure you get it, and who is going to get that. That's all next week on Coping with COVID. I want to leave with today's passage from Jesus Calling, as I've done the last couple of weeks. And this is so good. But Jesus Calling, I don't know, Nicole, if you have this devotional. It doesn't matter what is going on in your life. This speaks to what you're going through in that particular time. I'm going to skip around, but I want to say, it says, in me, you have everything. In me, you are complete. Your capacity to experience me is increasing through my removal of debris and clutter in your heart. As your yearning for me increases, other desires are gradually lessening. Since I'm infinite and abundantly accessible to you, desiring me above all else is the best way to live. Here's the icing on the T, as my aunt says. It's impossible for you to have a need that I cannot meet. After all, I created you and everything that is. The world is still at my beck and call, though it often appears otherwise. Do not be fooled by appearances. Things that are visible are brief and fleeting, while things that are invisible are everlasting. We can always lean and depend on Christ, the solid rock. I'm Tre Tailor. Thank you to Dr. Nicole Edwards. Again, be careful, be safe, and continue to be blessed. I'm Tre Tailor. Have a great weekend. Thank you, Nicole.
Thank you.